welcome back. So a couple of episodes we focused a little bit on learning disabilities a while ago, didn't we, Karen? But
We
actually,
did.
as part of Smile Month, we've got a guest in from Oral B. So I'm going to let her introduce herself in a second. But yeah, today we're going to be focusing on oral health and disabilities. So a very broad topic, but we'll get as much discussed as we can, and I think we'll all stand to learn something from it. Now, I've got Dr. Gillian Howie here, and I'm going to let you introduce yourself. If you want to just say who you are and what you do, that'd be great.
Lovely, thank you very much. So it's great to be here. My name is Jill Howie and I am a consultant in special care dentistry, currently working in Northampton.
And so how long have you been doing working in special care dentistry?
I started my training in special care pretty much as soon as I left dental school. It's always been an area very close to my heart. I've been working in Northampton now coming up for 3 years. I'm relocated here from Birmingham. Birmingham was where I did my specialist training. So yeah.
Nice one. And what exactly is special care dentistry if someone doesn't know what it is?
In a nutshell, special care dentistry is about ensuring that groups of patients who would otherwise find it very difficult to access dental services receive the essential dental care that they need. And there's a whole host of reasons why patients might experience additional challenges in accessing that dental care. Special care is about reducing barriers by considering everything around the dentistry itself. It's one of the 13 specialist lists held by the General Dental Council, and dentists on those lists have to have met some minimum requirements and standards of training. But not everyone that works in special care dentistry is on that specialist list, and there's a lot of very experienced and skilled practitioners that work in our area too.
So what exactly do you have to do then that's different to a regular dentist? If it's, like you say, you've got to meet certain requirements and things, what does that entail? What sets you apart from just going to see a regular dentist?
Really the types of patients that we see. So broadly speaking, within special care, there'll be a sort of 6 groups of patients that we look after day to day. And those are patients with learning disabilities, those with severe mental health problems, patients with physical disability, those that have got complex medical considerations that might impact their dental treatment. We care for frail and elderly people. And then finally, people experiencing social vulnerability. So that includes things like homelessness. And there's a lot of evidence that all of these groups of patients experience significantly poorer oral health than the general population. And there's a number of reasons for that, very much sort of multifactorial on a very basic level though. For some patients, communicating pain is more complicated. So if they don't communicate verbally, then they might demonstrate that they've got pain in their mouth by hitting their head. And obviously that can result in serious injury, but that behaviour might just be the patient demonstrating that they're frustrated about something. And that something might be nothing to do with their teeth at all. So there has to be some detective work that we as special care dentists do before we can actually even establish if there's a dental need that we need to be addressing. Another factor is that some of these groups of patients are reliant on someone else to deliver their tooth cleaning or their mouth care, or at least to support them in that process. Many of the patients with medical conditions are on lots of medicines, and those can have an effect on their mouth. Now, most notably and most commonly nowadays, they can cause a dry mouth where there's a reduced volume of saliva. And without saliva, our mouths deteriorate really quite quickly. They might also, as a result of the medical problem, have an increased risk of infection. And if an infection does take hold, it might progress more quickly or have a greater impact on their wider health and well-being. And as a result of all of this, they might need a lot more treatment to be carried out within a dental setting, but they might not be able to tolerate those prolonged treatment appointments. And finally, quite frankly, with all that they have going on, they may just have other priorities, which is completely understandable. So within special care, we deliver often simple but wide-ranging dental treatments, but those treatments have to be of a high quality, they have to be robust and predictable because of the cohort of patients that we see.
Yeah, I can imagine the approach between all of those different 6 groups is actually quite different as well. You've got to change the way that you're giving the information or the care depending on the type of person that you've got in the
Absolutely.
clinic. Yeah.
Yeah, yeah. And I think, we spend a lot of time planning with our patients, and where necessary, we obviously involve the other wider support network that might be involved in their care. And for those who can engage in that planning process, we work with them. For those who can't, we have to think about what is the least restrictive option for them, and how might we make it a bit easier, or at least less distressing. And frequently we'll achieve that by delivering the dental treatment that they need under sedation or under general anaesthetic. So it's not all about the dentistry in special care. The dentistry is sometimes considered a very small part of what we do. And I think we're in a really privileged position in special care, because we get to advocate for our patients. We get to be their voice at a time where they might feel that they struggle to have that voice heard. And one of the highlights of my job as a consultant in special care is that close liaison, close working with other dental care professionals, as well as the medical specialists. And I think in many ways, special care dentistry is the epitome of holistic healthcare, because our services might be community-based or hospital-based, and we can often offer shared episodes of care with other teams who are also working with a patient. So recently, my nurse and I went along to a gastroenterology theatre to provide dental care while the patient was having a general anaesthetic for an operation on their stomach. And we'll often return that favour on a Friday morning during our theatre list, when ophthalmology or podiatry, or sometimes even a hairdresser comes along to make it a bit easier for a patient. And those networks they're incredibly rewarding and beneficial for the patients that we see, but it's also fascinating from a personal perspective, because I get a front row seat in some of these really exciting procedures.
I've
And
never heard of anyone doing that. That's incredible. But it makes a lot of sense.
Absolutely. Yeah, it's a great opportunity, because we know that there's risks involved in patients having general anaesthetic. And so if we can really optimise the encounters that we have with our patients, then that's a great thing all round, and makes a lot of sense. And I think that sort of multidisciplinary team is absolutely at the heart of what we do. And it is certainly mentioned a lot when you hear people speaking about special care. But what I will say is, I think it's important we don't forget about our team closer to home, because the sort of true unsung heroes in my day-to-day management of patients are undoubtedly the dental nurses that I work with. I just wouldn't be able to function without their support. So whether it's the extensive workup of admin and legal processes, or preparing the clinic for a day of sedation, or just being completely flexible in the moment so that we can deal with the inevitable unpredictability of some of the patients that we see, they're fantastic. And I've been very lucky in my previous job in Birmingham and currently in Northampton to work with teams that are truly committed to getting the best outcome for the patients we look after. So it's really an honour to be part of those teams.
I'm sure Karen will be pleased to hear you say that as well, because Karen's been a dental nurse for a very long time and is so open and passionate about including them in the team. So I'm sure you've made her very happy saying
I'm
that.
smiling all over my face. That's wonderful. It is, I mean, and it is a team effort, and more so with special care dentistry. Obviously, it takes everybody to make it work, doesn't it? And it sounds absolutely fascinating.
It certainly is. Never a dull moment.
And the patients that you've got, how do they get to come and see you in the first place? Like, I know I've never heard, because I'm not dental, about how anyone can even start the process of having to go and see a special care dentist. Does it have to come from a GP, or like you say, you've worked with other like surgical specialties and things? Do other departments make a referral to you, or how does that even work? Because I'll hold my hands up. I really don't know.
So there's a number of pathways into special care services, and the reason there's a number of pathways is because that's one of the ways that we try to reduce the barriers that I've touched on already today. So lots of special care services will still accept self-referrals, and that might be through a website or accessible on a paper copy from a clinic. We accept referrals from general dental practitioners primarily, but also other dental specialists like oral surgeons or restorative services. And we see patients that have been signposted to us by healthcare professionals like general medical practitioners, GPs, community nursing teams, learning disability teams, and we take some direct referrals from specific medical teams. So in my trust, that's predominantly cardiology and palliative care as well.
Yeah, because I mean, I'll be honest, one of the things we get asked, especially Karen, I know you can touch on this way better from when you used to work on our dental helpline, but it is quite a common request that we get in terms of how to reach people like yourself, for people that need more support.
Absolutely. I mean, I still probably get 4 or 5 emails a week asking how to get to see a special care dentist. And, there are obviously restrictions in and waiting lists, etc., in a lot of areas. So it can be difficult, and it is difficult for people to know where to start, really. If they've got a child who perhaps needs to be referred, they really do not know where to start. So they kind of start with us, and then we kind of put them onto the pathway that they need to help them get that referral.
Yeah, and I think worth noting as well there, Karen. You mentioned parents with children that they're looking to gain access to dental services, and special care dentistry is an adult specialty. So we only see patients over the age of 16, but a really crucial phase in the lives of these patients is that transition from paediatric services into adult services. And that can be quite a vulnerable time, and we need to make sure that transition is as seamless as possible, and that they can still access the support from special care dentistry that they may need.
Now, in your sort of scope of the things that you do, I have a feeling the answer to this question might be a lot more broad than I initially expected, just hearing the sheer scale of the things that you can go and do, like you say, with the general anaesthetic. But are there any limitations to what you can do in your role, or is there times where you have to say to people, I can't do this, I need to refer you on to somebody else? Or are you generally in kind of a position where you can take on, like the vast majority of things that you need to?
Hopefully what you can see with the discussion so far is that there's incredible variety to our work, but that does create some challenges. As Karen touched on a second ago, we're a relatively small specialty in dentistry, and we need to use the resources that we have efficiently. And that can be a challenge, because all too often the patients who really need us are not the ones with the loudest voices or any voice at all. And we need service access criteria that make sure that our services are reserved for those who would benefit from the additional knowledge and expertise that we can bring. And not all patients that would benefit from our input have got an official diagnosis, and the information that's shared with us on a referral form might be lost in translation, and we might not actually appreciate their level of need, or the need for access to special care services. So what I think is crucial going forward is that we work with commissioning teams and as part of, you know, integrated care boards to make sure that the services we're developing and we're contributing to aren't operating in silo, but they're truly collaborative. And in special care, that's particularly important when we think about how general dental services and the specialist services work together. There can be a tendency for one to be played off against the other, but what we really have here is an opportunity for shared care. And we have to remember that there is a patient at the end of what is a potentially political conversation. And that was one of the things that was so encouraging and refreshing about the big rethink that Oral-B and IADH have been working on. So the focus of the big rethink event that I've recently attended in Amsterdam was not only the modifications to the oral health care aids, but also the launch of the Disability Champions programme. And this is a programme for general dental practitioners with the aim of making oral care more inclusive, more accessible and positive for people with disabilities. Not only the people with the disability, but also their carers and us as dental professionals. So the way that's going to work is that by completing some online training and then implementing some sort of accessibility suggestions for the practice, dental staff will earn a Disability Champions Award. And that comes in the form of a badge that they can use within their surgery or on social media. And their practice will also then appear on the Oral-B website, with the idea that patients will be able to search for practices in their area and find disability positive dental practices near them. And the hope is that that will go some way to patients feeling more confident about visiting the dentist. Now, that work will take place in primary general practices, but will have a huge impact on our specialist service much more generally. And firstly, that's because it allows patients that don't need specialist services at that point in their journey to avoid referral into us. But it also means that the prevalence of oral disease in the patients that might be referred at some point in the future is reduced. And I think it's such a proactive and sort of preventive message that runs through that programme, and I do hope we'll see some great results from it. But just to sort of tie up that point, we have a real responsibility to our patients in contributing to these discussions and promoting that collaboration, but we also have this opportunity to make it work. And although that responsibility ultimately lies with us, that doesn't mean that the fault sits purely at our door, and we need to be well aware of the bigger picture that we're working within at the moment. We are at a pivotal point for NHS dentistry, and I'm not going to veer off into any political discussion, but we do find ourselves at a bit of a crossroads in terms of the changes that might be about to come. And we should think about what else is essential to making programmes like Disability Champions Awards sustainable. And that's things like fair remuneration and access to support through transparent pathways. And these are the things that will allow us to benefit from high standards of care as well as being a valued workforce.
Yeah, I couldn't agree more. I mean, it's certainly, a lot of dental practices could be treating patients that get referred. They just don't know how. And that program sounds amazing that they can do online and just get the confidence of just knowing how to treat people and treat people well. Obviously, politics is right at the forefront of all of our minds at the moment, but we do need to get some sort of proper remuneration for the NHS and make sure that the NHS dental service is fit for purpose and treats everybody how they should be treated.
Absolutely. And I think, Karen, you raised an excellent point there about knowing how. And I think another opportunity at the moment, I do prefer the word opportunity to challenge, is recruitment to special care dentistry, and getting some motivated and enthusiastic students engaged with our specialty, and particularly in a community setting, because often community settings are inherently more accessible to the patients that need us. Now, there are certain situations where we are required to work from a medically supported setting like a hospital so that we can carry out treatment safely. But when students start out at dental school, special care is probably pretty far from their mind. But in all honesty, it brings together so many aspects of dentistry. And the reason I've ended up in special care is certainly multifactorial, but has a lot to do with the variety that it offered in terms of exposure to lots of different types of dental work. And, you know, the initial question was about limitations, and we do sometimes have to deliver a compromised treatment plan. But importantly, that compromise isn't necessary because of a lack of skill or resource on the part of the dental team. It's simply because that less invasive option is the right thing for the patient. And that's a very different mindset after dental school, because we are still striving for a gold standard, but the parameters are totally different. And so the end point looks different. And a dentist needs to get used to seeing that gold standard through the eyes of each individual patient.
Absolutely.
Definitely. I mean, I've always said at the end of the day, all people want is to not be in dental pain and to be able to smile. And anything more than that is always a bonus. But you know, for a lot of people, as you say, they don't need to have a Hollywood smile. You know, that's not what we're aiming for here. We're aiming for good care that is individually tailored to that patient's needs, to be able to eat basically and not be in pain.
Yeah,
absolutely.
Yeah. I'm just wondering, because this genuinely is a topic that I could talk to you about for so long, and if we can just think about like a final nugget of advice, if you like. So if you could pass on any advice to anybody about oral health or oral health care, what would it be? I mean, that could be to carers, it could be to some of the patients that you've seen, or to not to bring politics up again, but policymakers or anyone thinking about going into this specialism. What would be your one golden piece of advice, if you've got one? I know that's a broad question, but yeah, what would you say?
Well, I'm going to choose two. I can't give you one, but
okay,
two I could
fair enough.
And my first one is going to be in relation to carers and those who are supporting patients with disability in achieving oral health. Because I would say to carers that when you're working with dental professionals to develop an oral care plan for someone that you look after, it's really important that you know your place, because you are the expert on that patient and their circumstances. We might have some expertise in dentistry and even special care, but you are the expert on that person. And by you sharing your thoughts and contributing to those plans, we will arrive at a more productive, a more positive outcome all round. So work with us, tell us what you think might help, what will definitely be a hindrance, and we'll get there together. And I think my sort of final thought for the day, the question we have to ask ourselves and those around us at the moment is how NHS dentistry can support our changing population in an equitable and an effective way. And I think we can all contribute, even if in a small way, to establishing an answer to that. There was a fantastic poem published during the COVID pandemic by Damien Barr. And he says, I heard that we're all in the same boat, but it's not that. We're in the same storm, but not in the same boat. And my colleagues will be sick of hearing this because I like to make reference to it at any opportunity I get, because it's so relevant in special care just now. We are all in the same storm in regards to the challenges in accessing dental care. But the patients who require special care services are facing that storm without a boat. And it's our job in special care dentistry to be their boat in that storm. So yes, that's it's a great privilege to work in special care. I really do think that I have one of the best jobs in the world most of the time. And I hope that's been helpful.
It really has. I mean, we can't see you at the moment, but you can feel the passion that you've got for your job. And that's so important, especially when you're dealing with vulnerable people. Let's be honest, you need to be really passionate and keep that motivation for what you do, because I'm sure it can be really challenging. And it's been a privilege to learn about it. And if unless Karen's got any burning questions for you, and we'll let you get on to your very busy day. But I wanted to thank you again for giving your time to sit and talk to us on our podcast, because I know that this is going to be very interesting to more than just me and Karen. Lots of people, I'm sure, will take something away from the conversations we've had.
Yeah,
Thank you very much.
absolutely. It's been amazing to speak to you, and what you give to people is probably something that they've been looking for a long time, and being pushed from pillar to post for probably sometimes years, and finding a safe space where they're going to get the treatment that they need in a way that they need it has got to be really comforting for them. So yeah, it's been amazing to speak to you.
Thank you so much. Thanks for having me, and thank you for your time.